set equipment here.
It's a totally new setup today. Picture-in-picture, and then we're going to have the slides in there too.
Okay.
Are we live? Ready when you are.
You starting, Tyler?
Go first, yeah. Ready to go? Okay. Great. Well, thank you, and good afternoon, everyone. Happy holiday weekend. I know that Easter and Passover, as well as upcoming Ramadan, may be a bit different for people this year. Thank you for finding new ways to celebrate and observe these important occasions. Thank you as well to the healthcare workers, first responders, and other essential workers who continue to support Albertans this holiday weekend and beyond. I'm extremely proud of how our healthcare workers and the system as a whole is responding to this crisis. As Premier noted earlier this week, Alberta's modeling indicates that our healthcare system will be able to manage the peak of the virus should the data continue to trend as it is. By the end of April, Alberta Health Services will have 2,250 acute care beds, almost 1,100 ICU beds, and about 760 ventilators. This is more than enough to meet the projected demand for hospital services during the peak of the virus. I'm also pleased to report our success in sourcing personal protective equipment, or PPE. Alberta Health Services is a sophisticated purchaser, and while many are making spot purchases around the globe, our healthcare system here in Alberta has the scale and the time horizon to build on long-term relationships with manufacturers. It's one of the benefits of having a provincial coordinated healthcare system. Thanks to the leadership and procurement expertise of JP and his team here at AHS, and thanks to that leadership, we have recently signed contracts totaling more than $200 million. And these contracts will include tens of millions of gowns, millions of N95 masks, tens of millions of procedural masks, and many other products. And these products are sourced from companies from all across the globe. Deliveries have started and will continue over the next few weeks. This adds to our current supply, which Premier referenced earlier this week. Alberta Health Services is prepared for the need for PPE for the anticipated surge, as well as ensuring that Alberta has the supply of masks, gowns, gloves, N95 respirators for the future. In addition to supplying its hospitals and healthcare centers, AHS also supplies the PPE for physician offices, continuing care sites, seniors' lodges, pharmacists, midwives, emergency shelters, and EMS. And I'm grateful to JP and his team for helping all of our province be prepared and safe. Our purchasing and preparation success means that we can look beyond our borders to help provinces who may be struggling. We will be sending PPE, including N95 and procedural masks, gloves, goggles, and ventilators to our fellow Canadians in Ontario, Quebec, and British Columbia. And this is the right thing to do. Our government's first priority will always be Albertans. Our team of health experts is very confident in our modeling data and our expected need for PPE and ventilators. I assure all Albertans that we will have ample supply. We are in a position both to keep Albertans safe and to help ensure that Canadian healthcare systems from coast to coast to coast are equipped to take on the challenges ahead. Now, as you break bread with your family this holiday weekend, perhaps virtually as my family is going to be doing, remember one of the best ways that we can take care of each other right now is to take steps to prevent the spread of COVID-19. Stay home as much as possible, practice physical distance and good hygiene, and monitor for symptoms. It's up to each person to do their part to flatten the curve of the virus and to reduce its impact on Alberta. Thank you. I'd now like to invite Premier Kenney to come to the podium.
Thanks very much, Tyler. And folks, what you can't see from at home is that we are in an AHS warehouse that is 150,000 square feet, approximately. We have 9 warehouses, 2 of this size, filled with equipment. And we wanted to make this announcement here to demonstrate Alberta's readiness for this pandemic. I'll get to that in a moment, but let me begin by wishing everybody who is celebrating a blessed Easter, as well as friends in the Jewish community, a happy Passover. And on Monday, the Sikh community will begin to celebrate Vaisakhi. as well as also known as Khalsa Day. And I wanted to begin by noting that all of these and other faith traditions, the Islamic community that will soon begin commemorating Ramadan, each one of them had their own version of the Golden Rule, the idea of do unto others as you would have them do unto you. And at this holy time of year for many people, many Albertans, it is, I think, useful for us to stop and dwell for a moment on that common concept that runs through all of those different traditions. In Christianity, it's expressed as the idea of charity, of expressing God's love through love for our neighbors. In Judaism, it's expressed in the tradition of tikkun olam, or to repair the world, the notion of bearing responsibility for others. And in Sikhism, as we prepare for Vaisakhi on Monday, it's the notion of seva, the idea of doing work or service for others without any expectation of reward or compensation. And all of these concepts of the Golden Rule were beautifully summarized in a way that's relevant to the coronavirus pandemic for me by a recent statement by a Chabad rabbi, Barry Farkash. And let me just quote from this. He said that, quotes, "Exponential growth is not exclusive to viruses. We can also create exponential growth when we reach out to 2 to 3 people every day to say hello, check in, and share kindness. If every person who receives kindness passes it on to 2 or 3 more people, that will also create exponential growth. The math is exactly the same. So, make a commitment to check in with 2 or 3 people every single day. Reach out to family, friends, neighbors, coworkers, former classmates. Even a short text message can make all the difference. And if we counter social distancing with exponential kindness, we may just bring the light someone needs during this difficult time," unquote. So thank you to Rabbi Farkash for that beautiful expression of how we can apply the Golden Rule even in these strange times. And I have another important public service announcement to make before today's announcement. Yesterday, I received an email at the Premier's inbox from Veronica McLaughlin, who identifies herself as an 8-year-old living in Calgary. And she said, "Dear Premier, I'm worried about Easter this year. Is the Easter Bunny going to be able to come and hide the eggs? My whole family was wondering and worrying about Easter, and we are wondering if you know if the Easter Bunny is going to come this year. Can you lift the travel ban for the Easter Bunny? Please respond soon. Yours sincerely, Veronica McLaughlin." So Veronica, if you or other kids are watching, I'm pleased to assure you that we have declared the Easter Bunny an essential service, and there is no travel ban. We ask the Easter Bunny, however, to observe the hygiene protocol and to wash his hands for at least 20 seconds under hot, soapy water frequently, and we know, Veronica, you're following the same advice. So, before we get to the substance of today's announcement, I also have the latest update on figures from Alberta Health Services. The most recent data is that we have seen an addition of 69 confirmed cases of COVID infection over the past 24 hours, bringing us to 1,569 confirmed cases, and that is on nearly 73,000 completed tests. 47 Albertans are hospitalized due to the coronavirus. That's a reduction of 1 from yesterday. We continue to see 13 people in intensive care units as a result of COVID, and I'm sad to report 1 additional death as a result of COVID infection, and that individual passed away in Calgary. We express our condolences to the family of not just that person, but all 40 whose lives have been lost over the course of the past 3 weeks in Alberta from this pandemic. I can also report that we have seen 744 recovered cases, which is 48% of all known infections. We can also take confidence and encouragement from the relatively low number of hospitalizations. In fact, the number of individuals in ICU as a result of COVID-19 is down slightly this week. and hospitalizations have been quite stable this past week. Our numbers are far lower than the hardest hit areas of Europe, the United States, and significantly lower than we've seen in provinces like Quebec and Ontario. Earlier this week, we shared the models developed by Alberta Health to chart the possible future trajectory of the pandemic in our province. They suggested 3 scenarios, starting with the probable one, which would see a total of 800,000 infections during the primary wave of the pandemic ending in August, and a peak of 818 hospitalizations and 232 ICU patients in late May or early June. The second, or elevated scenario, would envision total infections of just over 1 million and a peak of roughly 1,600 hospitalizations and 400 ICU patients in early May. And as I explained before, they also prepared an extreme scenario which would only apply had we not taken rigorous measures to date. The Alberta Health modeling charted anticipated hospitalizations and ICU admissions against the planned expansion of hospital and ICU beds for COVID patients. So far, we are outperforming the probable scenario and doing much, much better than the elevated scenario. The probable scenario envisioned over 200 hospitalizations, including about 30 in ICU, but today we're far below that, as I've said, at 47 hospitalizations and 13 in ICU. So we are at about 1/4 of the modeled levels under our probable scenario for today, and that is very good news. It is not a reason to stop our collective efforts to stop the spread, but it is a reason on this weekend of hope for many people to take some hope in the progress that we're making. This adds to our growing confidence that under both the probable and elevated scenarios, we'll have a substantial excess capacity of beds and medical protective equipment beyond the expected need. Now, let me just say again that we have this excess capacity of equipment, both protective equipment and ventilators now and anticipated as we grow those supplies, in part because of the excellent pandemic planning that has been done for a long time. On the very first day when we, I think as Albertans, really started to focus on this, about 3 weeks ago, following the World Health Organization's declaration of a global pandemic, and when we started to see cases manifesting in Alberta, on that very first day, I pointed out to Albertans that we were well prepared, that we have had a influenza pandemic plan in place since 2014, and that it was exercised in November. And part of that preparedness was the excellent work done by Alberta Health Services Procurement Division, led by Mr. Jitendra Prasad, who you'll hear from in a moment, who have really harnessed the enormous purchasing power of the one centralized administration of healthcare in Alberta. We are the largest single point of purchasing of healthcare equipment in Canada, and we rank on a global scale in terms of our purchasing power. Mr. Prasad and his team have used that to develop deep relationships with suppliers around the world. And when Mr. Prasad first heard intimations about a potential virus of this nature late last year, AHS surged orders for equipment to get ahead of the queue. And that is why we are now receiving enormous shipments of supplies, PPE, and we are on track, in fact, ahead of track. And let me just say that I actually, because of the success of AHS procurement, because of those privileged relationships we have with suppliers around the world, complemented as well by progress that we are making with domestic development and procurement of products here in Canada and in Alberta. Because of those things, I directed AHS procurement last week to go big, to effectively order as much supplies as they can so that we could then in turn share excess supplies with fellow Canadians, as some other provincial governments were not as advanced as we were in stockpiling materials. Because we are so well equipped, I am pleased to announce that we are able to contribute 750,000 N95 masks, 4.5 million procedural masks, and 30 million protective gloves to provinces that are right now in need. Our stockpile also includes a large supply of ventilators, which are a last-ditch defense for severely ill patients in the ICUs. We are doubling our supply of ventilators to more than 760 by the end of April. That means we expect to have about 500 more ventilators than the 200 or 30 that we will require under the probable scenario, and well over 300 more than the approximately 400 we would need under the elevated scenario. For all of these reasons, Alberta finds itself in a position to help some of our fellow Canadians living in parts of the country who are facing much worse spread of the infection and are less well prepared than we are in terms of equipment. I am therefore very pleased that Alberta is in a position to share medical resources with other provinces facing urgent shortages of life-saving equipment, including ventilators. The current hospital need is particularly in Quebec and Ontario. Their rates of infection, hospitalization, ICU admissions, and death are much higher than ours. And some of their models indicate a high risk of shortages of personal protective equipment and patient treatment tools, including ventilators. We are therefore making the following equipment immediately available to Ontario, Quebec, and British Columbia. First to Ontario, which is currently reporting more than 6,200 infections, 673 hospitalizations, including 260 in ICU and 217 on ventilators. They've also sadly seen 222 deaths of date. To Ontarians, we are providing 250,000 N95 masks, 2.5 million procedural masks, 15 million gloves, 87,000 goggles, and 50 ventilators. Secondly, to Quebec, which is currently reporting nearly 12,000 infections, over 700 hospitalizations, including 186 in ICU, and approximately 250 deaths. To Quebec, we are sending immediately 250,000 N95 masks, 2 million procedural masks, 15 million gloves. And lastly, to British Columbia, which, like Alberta, has had great success so far in containing the outbreak, but has experienced a relatively high number of hospitalizations and is short on N95 masks. To British Columbia, we'll be sending 250,000 N95 masks. I want to stress for my fellow Albertans that we are absolutely confident that these contributions will in no way undermine our capacity to provide critical protective equipment and ventilators to Alberta's medical professionals, to other associated frontline workers, and to care for those in need of it. We would not contribute if it in any way impaired our ability to provide for our own healthcare needs. But I, for one, as an Albertan and as a Canadian, could not in conscience watch us stockpile massive amounts of surplus equipment while we see many of our fellow Canadians in some provinces within days of running out of some of these supplies. We are all in this together. And let me refer back to how I began by talking about the golden rule: do unto others as you would have them do unto you. That tradition of charity, of tikkun olam, of seva, that tradition of sharing. Other Canadians at times of need in Alberta's history have shared with us. In the Great Depression, Alberta was the recipient of a great amount of generosity from people in central Canada at a time of great need. And we are also going to need the support and solidarity of our fellow Canadians to cope with the huge economic challenges that we are facing as a province. And let me pause there to say a word of sincere gratitude to my fellow premiers across the country. Every week we gather and meet by teleconference, and in every one of those meetings, I have been truly moved to hear expressions of real solidarity from across the country for the uniquely deep economic adversity that Alberta is facing, not only because of the global coronavirus recession, but also because of the meltdown in energy prices and the way that it will inflict even greater economic adversity on our province after 5 years of economic challenges. I have heard premiers from provinces that are much less well off generally than Alberta, raising as a priority time and again with the Prime Minister and the federal government the need for solidarity for Alberta and including Alberta's largest industry, our energy sector. And so I want once again to thank our fellow Canadians from coast to coast for their understanding of the uniquely big challenges that we are facing. So on these supplies, we are in a position to help our fellow Canadians, and doing so is the right thing. We're all in this together, not only as Albertans, but as Canadians, and this, today, is a practical expression of that. Let me say that many of these goods and supplies will begin to ship immediately throughout this week, and as we continue to replenish Alberta's supplies, more will be available to share with other provinces if and when they require those supplies. But I, for one, will not sit here with 9 massive warehouses of equipment that is full if we see a few days from now our fellow Canadians overwhelmed potentially in their healthcare system because of a shortage of supplies. So I think this reflects the natural generosity of Albertans with one of the highest levels of charitable giving in the country, with a great spirit of volunteerism and a true sense of patriotism. I'm pleased and proud to make this announcement on behalf of all Albertans. And now I think we'll hear from Mr. Jatindra Prasad, Director of Procurement at AHS.
Thank you very much, Minister Chandru and Premier, for your kind words and your confidence in Alberta Health Services supply chain. Now that the Easter Bunny's been named as an essential worker, we'll probably try and make sure we send some protective equipment to the bunny as well. And with that, I'd like to give you a little bit of an overview and confidence in our supply chain. So one of the things that you would never see in a healthcare organization is somebody from supply chain actually doing a press conference. We're generally people who are behind the scenes that ensure that supplies are available, but different events call for different types of people to step forward, and I think this is where supply chain needs to take that step. So this pandemic has demonstrated that supply chain is an extremely essential element of the healthcare system. And my experience in supply chain actually comes from a very clinical background. I used to be a pharmacist many, many years ago, and then transitioned over into supply chain. So when I look at supply chain, I generally look at it from the perspective of what do we need to do to make sure that our frontline staff actually have the supply and the confidence that we'd be able to provide that supply on an ongoing basis. And that belief is also reinforced by the fact that I have 2 very elderly parents, and then at the same time, I have a daughter who'd be completing nursing in a few months' time, or would have been done now, but now will be probably done later in the year. And the need to protect staff in the front line is also very, very personal as well. So our planning has been ongoing for a little while, and we have been really working hard to harness what we have on behalf of Alberta Health Services, which is really leveraging our vendor partners, really leveraging our reach, and really working very, very hard to make sure that supplies that are available are brought into Canada. We have been working with global suppliers and global manufacturers. We have the capability now to contract directly with those manufacturers, and those manufacturers have been very, very good about making sure that products that are manufactured meet the standards. We've gone through all of the approval process, and those supplies are going to be coming in. Some have already come in, and there's large shipments, I think, as alluded to earlier, that are going to be starting to land starting tomorrow. From our standpoint, why are we confident with global manufacturers? It's because we work with them every night. As I was showing it to someone earlier today, time-stamped video of supplies that are waiting at the airport in Shanghai to be loaded on our planes, so that they can actually leave the airport with all of the pre-customs clearance and everything else done. And so there's a high level of confidence in the suppliers that we are working with, as well as in the transportation networks that we have established with some of the airlines in order to try and bring those things up. So one of the things that I would like to say is that when the Premier made the announcement about donating supplies to the other provinces and helping out fellow Canadians, I would like to reiterate that, and this is to all of the people at the front line of fighting the pandemic, that we're very confident when we made those commitments to those provinces that we are in fact going to be able to meet the needs of Albertans and at the same time be able to help those provinces that today may be struggling a little bit with supplies and may not have enough supplies, particularly given the fact that we are at a point where you can see the trajectory of the disease in those particular provinces. So I think it's really a great honor that we are able to do this, and I think it does demonstrate that Albertans will always stand with fellow Canadians coast to coast. I'd like to close with two important points, and these are critical to me. One is that we're very, very fortunate that we have a single healthcare system in Alberta, which has given us an enormous amount of experience in being able to do the things that we are doing today. And a lot of credit goes to the leadership of AHS, to the support that we have from the government, the Premier personally, and the Minister. And I think that has really allowed us to do the things that we are able to do. I actually met the Premier for the first time last Friday. And I was very, very pleased with the fact that he gave us the direction to move forward and purchase so that not only do we help the Albertans, but also help other provinces at the same time. The other point that I'd like to stress is that this is not something that we just jumped into. We've been planning for this for a little while. We've dealt with other major disasters in the past as well. So there's tremendous amount of experience, and it is that experience that actually comes to the forefront whenever you have an event like this and we have to respond in the fashion that we are responding. Finally, I would like to take this opportunity to acknowledge and thank all staff from CPSM across the province. I know how hard you're all working, and I know that every day we put new demands on you, but you've all stood up and you've done the best. And I really want to thank you and acknowledge the hard work that you're doing, as well as all of the frontline AHS workers and all of the people of Alberta. Thank you very much.
Thank you very much. We'll take questions now. So, operator, could you please put through the first caller?
Yes, so this first question is from Chris F. of CTV Calgary. Your line is open. Please go ahead.
Thank you. My question is for Premier Kenney. You're saying basically nearly half of Alberta's cases are now in recovery. I know 3.5 weeks ago you projected mid-April as being the peak time. That's now been extended to May, presumably because of flattening the curve. Yeah. We're actually giving away medical equipment now. At what point is it safe to say that what we've been doing for the last month is working?
I think it's safe to say that right now. It is working demonstrably. We see a stable number of hospitalizations and ICU admissions. In fact, ICU are down a little bit. As I said last week in my televised address, the most important number to watch is the hospitalization and ICU number, because that's the ultimate indication of how many people have contracted COVID, for whom it has really challenged their health. And those numbers have been stable. We see the number of people recovering going up. I'll just share with you a personal example. My friend Jay Chaudhry from Calgary was in an ICU for most of the past month. And I'm pleased to have gotten a text from his wife this morning that he's now been released from life support, and he is his health is still challenged but recovering. So for me, on a very personal level, it's great to see that. So listen, we're not out of this yet, and I don't want people to take this good news as a reason to relax their rigorous observance of the public health orders and the social distancing rules that we have put in place. I said on Tuesday that the models were not our fate, but rather they were a challenge, and that whether we hit the big numbers in those models or not is up to us in the choices that we make. The fact that so many people are inconveniencing themselves and making sacrifices during what would normally be a beautiful spring holiday weekend, the fact that so many people are staying at home and not traveling around or not crowding into the shopping malls or parks, that is exactly why we are in a good position today. So I want to thank Albertans for following Dr. Hinshaw's advice, for observing the public health orders that the government has put in place, for maintaining that social and physical distancing, for caring for the elderly and the frail. We are winning this fight. It's not over yet. We have a ways to go, but so far we're on track for I think, a successful Alberta battle against coronavirus.
Operator, can you please put through the next caller?
Yes, the next question is from Tim Brook of CTV News.
Hey, again, question for the Premier. I'm just curious to know, I mean, you mentioned we're at a quarter of the way, or at least a quarter of the projections. When did it start to kind of become clear to this government that the move today that's being announced was going to be announced? When did you kind of look at the numbers and say, okay, we have some PPE that we can spare here and maybe it won't be quite as bad as we thought it was going to be?
Well, about 10 days ago, I started to ask the Department of Health and AHS to give me options on what we could share, because it started to become clear to me as I saw the daily reports of our supplies, what we had on order, and the number of cases, that we may very well have significant excess capacity here. And I can tell you, about a week ago, I was starting to get some very urgent calls and texts from some of my fellow premiers about the very tight situation that they were facing. So about a week to 10 days ago, I gave direction that we begin preparing for today's announcement. We wanted to wait a little bit until we landed some supplies recently and saw the tangible progress on some outstanding orders. So we wanted to be doubly sure that we had a margin for error in terms of our excess supplies. And Mr. Prasad and his team have done brilliant work. They've put us in a position where we can do this. So we've been going in this direction for a week or 10 days, and I'm just pleased to be here now. And quite frankly, if we land some more major orders that are coming in, and we also step up our domestic procurement efforts, we're working on that through our Bits and Pieces program, I think we can do a whole lot more should other parts of the country require it in the weeks to come.
Operator, can you please put through the next caller?
Yes, the next question is from Kevin Orland of Bloomberg. Please go ahead.
Hello, Premier. So OPEC Plus appears to be closing in on a 10 million barrel a day cut in production, and also the G20 yesterday has said it will work towards balancing the global oil market, but it hasn't made any specific commitments on that. I was just wondering if you could give your reaction to the efforts that are going on to balance the global oil market, and what kind of role, if any, Alberta's been asked to play in those.
Sure. Well, we're obviously pleased to see some progress made at OPEC Plus. Our Minister of Energy, Sonia Savage, participated in the 9-hour conference call on Monday, and it's all a blur this week, isn't it? She participated in that on Thursday, and as well, we were in very close communication with the federal government and in particular, Natural Resources Minister O'Regan, who participated in the G20 and energy ministers telemeeting yesterday. We have not been asked by OPEC to engage in further constraints on our production. Minister Savage had a lengthy one-on-one conversation with the Secretary General of OPEC 6 days ago. It was Sunday of the beginning of this past week. And that was not raised then. It was not raised during the OPEC call on Thursday. We've been very clear in conveying to OPEC, the United States, and others around the world that Alberta has already been in curtailment of production for the past 15 months, and that we cannot really affect global prices because we do not have global market access. We don't have those pipelines to the coasts. And finally, that we are constrained. Even if we wanted to surge production, we would be capped out at about 4 million barrels a day that we could ship through existing pipelines plus crude by rail. I think the main concern that OPEC Plus has with respect to North American energy is that we not end up either in the oil sands or U.S. shale surging production to consume the space created by curtailment in the OPEC Plus countries. And clearly that is not happening. It cannot happen under the current price environment. To the contrary, we have seen announcements of a reduction of 2 million barrels per day in production in U.S. shale because of the rock bottom prices. And I've seen some projections that we could see 1 million barrels a day or more shut in out of Canadian production. So I would say that Canada and Alberta in particular, North America generally, we are doing our part on the supply side. The problem is that the reckless actions of the Saudis and Russians over the past several weeks has filled up global inventories to a point where we are likely facing an extremely low price scenario for at least 18 months. And that is, there's just no sugarcoating that. It is going to create some real adversity here in Alberta, and that is why we constantly renew our call on the federal government to step up with a credit backstop for emergency liquidity for the largest subsector of the Canadian economy. And once again, I want to thank premiers from across the country in supporting us in that call.
Operator, can you put through the next caller, please?
The next call is Rob Drinkwater of Canadian Press.
Yes, Premier. Sorry, I got to ask this, but two of the provinces that we are sending PPE to, they have been hostile to pipelines. Is there any irony in that? And, are you expecting maybe payback for this gesture in the future?
People's lives are at stake. And so we are going to look past disagreements to saving lives, saving Canadians' lives, helping our fellow Canadians. And I obviously hope that our fellow Canadians will recognize in this contribution the generous role that Albertans have always played across the country. This is one practical expression of that at a time of need. But we Albertans contribute $20 billion more to the rest of Canada than we get back in benefits every year. That helps to fund their hospital systems, their healthcare systems, their schools and social services. So I hope that one of the lessons to be learned from this crisis is that we are all in this together. I hope there will be a renewed sense of national solidarity. And I think part of that should mean that we're all in this together, not only when it comes to a health emergency, but also when it comes to generating wealth through the responsible development of resources so we can have the money that pays for world-class healthcare to get us through times like this.
Operator, can you put through the next caller, please?
Yes, we have a follow-up from Chris Epp of CTV. Please go ahead.
Thank you. Premier, just wanted to follow up on my earlier question. Are we saying that you mentioned that the modeling that we had, and Dr. Hinshaw said this as well, that we're well underneath those numbers. Does that mean that even the probable scenario, and as I recall, that was 400 deaths, and I'm sorry, I don't remember if it was to 2,100 or 3,100, that at the rate we are now appear to be at, that the probable scenario is also dropping, that 400 deaths may not be the low end either anymore? It could actually be lower than that?
Well, let me be clear. As I said on Tuesday and Wednesday in presenting the modeling is not a precise prediction. The model is based on hundreds of different assumptions and inputs. In part, it was built on the experience that we saw in the United Kingdom because our epidemiologists, economists, and others who developed the model needed some kind of baseline upon which to base it. And we as a government, and let me be totally transparent about this. Early on, we as government were not getting very much from the system in the way of models. And I was frustrated with that because I found it very hard for us to know how to prepare, what kind of resources we needed to put where, and what the extreme case scenario was. We as a cabinet needed to know whether there was a plausible scenario where we were going to have to kit up emergency overflow hospitals in convention centers and warehouses like they've done in parts of Europe. We needed to know that. And so we pushed the system pretty hard to develop a model. They refined it and they refined it again. That's what we presented earlier this week. But as I said at the time, the model is not a prediction. It is a sense of where we might go based on certain assumptions. Here's the good news. People have been following the public health guidelines. They've been acting responsibly. They've been doing the right thing. And that's why, fortunately to date, we see numbers that are well below where the models would have us now. And so, once again, that is, I'll repeat what I said then. The model for me is not it's not a done deal, but rather it's a challenge that we are rising to, a challenge that so far we are meeting. But we need to see continued rigorous respect for the public health guidelines, the rules, the social distancing, the physical distancing. And if we continue to do that, we're going to get out of this, I think, better than the vast majority of jurisdictions in the developed world.
Okay, we'll take one more. Operator, can you please put through the last caller?
Yes, Adam McVicker, Global News.
Thank you, Premier and Ministers, for taking my question. I guess I have two questions here. First, we know you just announced another death due to the virus in the Calgary area. I was wondering if you could confirm where that was. And my second question being, could we expect to see any further measures being put in place following yesterday's announcement regarding long-term care facilities to protect staff and, of course, that vulnerable population? Thank you.
Yes. So yes, that sadly that was another case. The fatality was a former resident of the Mackenzie Town long-term care facility, and so we've seen now 83 confirmed cases there, and there's only one other seniors residence in Calgary where we've seen Carewis Sarcee, where we've seen 12 confirmed cases, and then there's the Center Manuel Dulac Retirement Home in, I believe, Bonnyville with 18 confirmed cases, and the Shepherd's Care Kensington in Edmonton Zone with 19 confirmed cases. And so those are a particular concern to us, as we've seen not just here but around Canada. Continuing care facilities are particularly vulnerable to a pandemic of this nature, and that is why Alberta's government has imposed, with the advice of our Chief Medical Officer, increasingly stringent protocols around the operation of the continuing care facilities. That was reflected in Dr. Hinshaw's announcement yesterday that we have issued a public health order to prevent staff at continuing care facilities from working at more than one facility. That will be implemented this upcoming week. We will be putting in place a number of measures to help provide for a stable workforce at those continuing care facilities, because we do not want to repeat here the horror story of what happened in Montreal, where suddenly you saw staff abandon the residents, and we need to support the workforce in these continuing care facilities. We'll be announcing this week a number of measures to do so. We've been working with the Alberta Continuing Care Association in that respect. And so just stay tuned for those additional measures, but also we've issued a public health order to require that all staff working at continuing care facilities use personal protective equipment. For some time, AHS has been providing a supply of appropriate PPE to the continuing care facilities, and we, of course, have included the residents of those facilities in amongst the priority population to get access to COVID-19 testing. Any continuing care facility that has had a confirmed case, automatically all residents and staff are then tested, and anybody who is obviously symptomatic in those continuing care facilities is tested. So we look forward to any additional advice from Dr. Hinshaw on other measures that need to be taken. But we obviously do have particular concern. And as we go forward into the relaunch phase, we will, as we begin to relax the public health orders and social distancing protocols, we will obviously place a particular focus on continued protection of our seniors in those facilities.
All right, that's a wrap. Thank you.
All right, so now I'm going to do this in French. All right.